we have Mariam Torosyan, CEO and founder at SafeYou. Hi, Mariam. She is combating violence against women through an app. We have Elina Tunyan, launching a healthcare company designed for improving maternity outcomes currently in the US. And we have Gayane Hovnannisyan, CEO and co-founder of Noomee, an app designed to help children with autism continue therapy at home. Welcome, Mariam, Elina, and Gayane. And before we proceed, I'd like to remind our attendees to feel free to type in their questions and comments in the chat and Q&A section for discussion towards the end. This is being recorded, albeit a little late, and we have tried to go on Facebook and under Armenian International Women's Association, parentheses, Aiwa. And if it's working on Facebook, then welcome Facebook audience as well. And now, without further delay, let us hear from our guests the valuable insight on women's economic empowerment and what it means to navigate the changing world of work. And perhaps the best place to start is at the starting point of their journey. Mariam, I'll start with you. You founded SafeYou, a mobile app that provides the user with a safety shield against domestic violence. Give us a glimpse into your journey. How did you get to where you are today? Why SafeYou?
Thank you, Silva, and everyone for this wonderful event. So I started my journey back in 2019 when I was pregnant, and it was a very pivotal moment in my life because there's a story behind everything, right? And an 80-year-old woman, Armenian woman, asked me, well, you look beautiful. Are you going to have a son? I said, no, it's going to be a daughter. And she turned really very sad, and she approached me and said, don't worry, the second one will be a boy. And I asked myself, what is wrong with this society and with this world that an 80-year-old woman asked another woman that being a woman is not that good as being a man. And I was invited at that time, to lead a research project supported by World Bank to find solutions to fight against gender-based violence. And after the completion of research project, I founded this startup to provide safety and empower women through community and knowledge.
That in itself is a story that moves you from where you started in your field to providing something for other women. You know, before I move on to the next question, to one of the other subjects, I just want to let people know that over the past 2 years with the COVID pandemic, a new pandemic hit, and it was called by the UN the shadow pandemic, because domestic violence and violence towards women and gender-related issues had increased enormously. So this comes at the right time. Thank you for that, what you're doing. Now, Elina, I will move on to you. You are working on launching a new healthcare company focused on improving maternity outcomes for women in the United States. You are in the United States. But prior to that, you were working on Wall Street, dealing with numbers and data. Why the shift? What inspired you to do what you're doing now?
Well, I guess similar to Mariam, it was having a child. So, you know, my journey, it was also a very pivotal moment for me. So leading up to the birth of my son, my husband and I did a ton of research on what to expect prenatally throughout the process, as well as postpartum, and how to raise our child. So for us, it was, and my husband is a co-founder. So for us, it was really experiencing this as a first-time parents. And I would say that having gone through the system myself, I realized how the system is just fundamentally broken, you know, in the United States and many other countries, but specifically in the US for being so developed, you know, there's still a lot of issues relating to maternal care. So, I think for me, it was this idea of like, no mother should have to go through the struggle prenatally and then postpartum, not having the support that they need. So I would say kind of tying that into what I've done before. So I was very analytical. So I've done a ton of research in the space to understand what are the numbers, like how bad is this problem? And it's incredibly bad. And so I've sort of joined my investment banking background, and then I've also previously started another startup. So I have this entrepreneurial background as well. And so married all those things together to launch this company.
It's wonderful. Your backgrounds actually help you in that, and it's really great to challenge our own boundaries, our own comfort zone, and bring it out to be able to share some of the problems that you have encountered, to bring them out to help others. So I really appreciate that. Now, Gayane, you are the co-founder of Noomee, which is a mobile app that helps children with autism spectrum disorder and those who have difficulty in organization and communication skills. Now, that is a very specialized field. And I'm curious to know what your story is behind Noomee. How did you come up with this idea? What's the story, the background?
Thank you, Silva. I would say my story started when I chose my profession. Since 2006, I've been working with special needs children as an occupational therapist. So I found myself in pediatrics and mostly in work with children with autism spectrum disorder. Why? Because they are different. They need unique approach, and it's always challenging a therapist to learn new skills and do self-development. That's good on one hand, but on the other hand, as a professional, you have lots of homework to do, and those homework you are doing manually. And a couple of years ago, I realized that I spent all my weekend on the preparation for Monday's half-an-hour session. Can you imagine if that time I used for real work with a child? So how many more children could benefit from the therapy? And realizing that it's obvious that the number of people needing special care is growing yearly, and there is a huge gap of therapies and people needed special care. So that was a hint myself that I need to do something, that in this digital world, therapists should not spend their valuable time on paperwork, and they need to do a more valuable thing, help the other people who needed their support. And the second reason that I started this, it's a personal. My sister has an intellectual disability, and I also remember my parents' challenges while they were helping her to grow up, to learn new skills and just be independent. So in Noomee, we combined my skills as a family member and as a professional, as a therapist.
Wonderful. And our personal experiences are sometimes our best teachers. And I want to give some people an idea about the work that you're doing, how, again, it's each of you, it's so important because according to the Armenian National Health Institute, the number of children with autism is much larger in Armenia than is recorded. And that is probably because of the stigmatization and shame that many families will feel in addressing the issue. So I think that you, all three, are providing a service that is very much needed in Armenia, across the globe, everywhere in most countries. But it's nice to see you coming back and helping Armenia, and at the same time, the diaspora and the rest of the globe. So now that we know what drives you to wake up in the mornings and work toward your goals, let's hear about some of the challenges, because it all sounds very easy. I did this, I had the experience, I did this. Now, Armenia startup ecosystem is growing. And it is truly gratifying, especially for us at Aiwa, to see more female founders in Armenia coming to the tech scene. Now, there is definitely a shift in the industry profile that is happening, but it doesn't come without any hurdles, I'm quite sure. So what are some of the challenges as female entrepreneurs? Anyone want to take that first, or do I have to direct it to one of you?
I can take it.
Okay, Mariam, go ahead.
Sorry. Yeah, in reality, being a female founder in this tech ecosystem, it's really very important, because I realized that it's also very inspiring for younger generation, and it's something very important to do, even though there are a lot of challenges, and it requires a lot of work, dedication, a lot of confidence to do this. But it's another drive that we see, that will also inspire other women, other girls, to find problems and also find solutions to those problems. And and of course, the main drive is building and contributing to the world that we want to see in the future, for us, for Armenian society, for global, for humanity. And of course, that's the main mission that drives us, but also being in this ecosystem helps us also to inspire and empower other women.
Yes, but I have another question to add to that then. What sort of a team do you work with? I mean, what is your team like? I mean, you're not doing this on your own. So what is the approach to building your partnerships and collaborations? How has that worked out for you as far as a challenge in now that the ecosystem is sort of the tech, women are more in the tech industry? Mariam, I'm asking you again.
Okay, it's to me. Okay, my team is all about dedication, enthusiasm, and it's a mission-driven team. So what we are doing and what is the mission of our solution, it's it's one entity. Let's put it this way. Okay. 85% of my team, like 90% even, of my team are women. And I'm also very happy that we have 3 guys with us supporting the same mission. But I'm also very happy that there are much younger women in my team that are working with me, and it's very enriching experience also for all of us to be on this challenging pathway together, and to overcome all these challenges together.
Yes, it's working with 90% women, and there are 3 men all in the team. That is a challenge for the men, I think, at this point. Kudos to you. Now, Gayane, what did it take to lead an idea from inception to implementation to bring it to this point? What were your challenges, or how did you do that?
Of course, it's hard. It's challenging and very often unknown. And I would not say that it's not hard for men to do business or run a startup. But if you have a goal, if you have a dream, you just go for it. You just need to be surrounded by people who believe in you. And the most important is those people should be your team members, your team. It's hard in Armenia to build a startup, to run a company, social impact business, because here you need to have also a patience. And it's a kind of new field that with more complications compared with others. So every single person in the team should have as much enthusiasm, no, even more enthusiasm than you, more motivation, and be a hard worker. I met lots of challenges, even there was a time that hiring a person, he just refused to work because CEO of the company is a woman. That could happen. Yeah. But yeah, if you have a goal, if you have a dream, you're just going, you just need to go forward and reach your goal. Without just, and accept, of course, that failures, it's okay. It's okay to fail, learn, take the lesson and just go.
That's how we, success is measured by how many times you failed and moved on to the next one, right? Yes.
Exactly. Yeah.
Elina, your business growth, we all know business growth requires a lot of networking, collaboration, teamwork, which all of you seem to already know and have mentioned. But Elina, I'm curious, given your knowledge of working in the financial district among more CEOs named John than Jane, what is your secret to weathering the ups and downs and staying on your strategy coming from such an environment?
I mean, I think the first and foremost, it's having the right team, you know, around you. So I mentioned earlier, my husband is my co-founder. And so together we really balance each other out. But I think the biggest thing with networking is leading first with just the business idea and the problem that we're trying to solve, because people can really get behind that, and then pulling in all the data and the analysis of why this problem is so big, maternal care, and what it costs employers, what it costs, you know, the health insurance, and what it costs costs to a consumer. So I think it's removing sort of the gender component and really coming first with the problem statement and why people should care and why is this such a big problem. That's where I tend to lead first. And then just surrounding myself around with people that are, you know, the right partners who understand the vision, who see the vision and really want to support me. So male or female, whoever is kind of like around it, because everyone knows someone who's had a child and has seen from their vantage point the kind of ups and downs of that, and they'd really like to get behind this idea.
It's perfect. Some of our best partnerships come from networking and establishing long-term mutually beneficial relations. Like you said, you surround yourself with a trusted and loyal team, and you are on your way. It makes all the difference. And a life partner who stands and supports you all the way actually creates greater opportunities for business growth.
And the other thing to mention is we went through, a few of us here went through the BAJ Accelerator. So that is the Armenian Accelerator. We went through that in the spring. And that is an incredible network for Armenian entrepreneurs. And it wasn't just a 1 month run, see you later, good luck. It's like an ongoing relationship with them where they're helping you along the way. So that is another really excellent avenue for the company to have access to other entrepreneurs, mentors, advisors, people who are out in the field raising venture capital funding for startups. So there's many aspects of support that you need.
And I'm glad you mentioned that, because I found all three of you through BAJ, through that, and saw some of the astounding work that's going on. So the three of you were the choice, and there are many others. But thank you for bringing that up. Yes, they stand behind, and they're great in their networking, their advisorship, mentorship associations. So yes, our partnerships come from there. What I'd like to do is move on to a bit of the impact that your apps may have had until to present. So I'll go to Gayane. You developed a solution to help a growing number of children on the autism scale improve their skills, their life skills, and that's an incredible feat. But tell us about your vision of success and what impact you already have seen with your solutions that you are offering.
Yeah, as we described, success is a group of failures. So it's even good to fail, to realize that you were wrong. And again, you just need to learn from those failures and move forward. We had so many failures. I think I stopped counting it, but the best, you are taking the lesson. And right now we're in a process of remodeling our business model, our approaches, and I'm pretty sure 2022 will be a magnificent year for Noomee and its stakeholders. But the desired state of Noomee, when in 10 years we look back, we would see children's progress with the help of Noomee, that Noomee helped to shorten the number of children who are in a waiting list, at least 10%, just to make sure it's like more than Armenian population. But even like small steps when parent write you a message that, you know, my child learned toileting skills and we were struggling with it, like a simple, very, very simple thing, but it's like makes you happy. You understand that, okay, whatever you are doing, you are making an impact, you are making changes. So that motivates you. And
it's interesting. I wanted to also ask you if the app is more for you, children, parents, or the therapist. So who uses it, or is it a combination of all three?
Exactly, it's a combination of all three. Children cannot use without a therapist or a parent. But children develop skills. They are learning to be independent. Parents learning how to use the app, how to continuous therapists at work, and it's helping therapists to save their time with the automatic way, automation that we created. And at this point, we did a research, and it's helping to shorten the time that the therapists are spending on a preparation of materials, about 25%. So it's a combination of all of it. It's a chain, you know, like children learning, they are happy, parents are happy, therapists have more time, and they can help more people.
You know, and with the with technology and with children, I'm fascinated that this is now available for children, because technology is a native language for children. They don't actually. And so another thing I need to ask you, because somebody just texted me, can you ask what language this is in? How many languages is this, or is this only in Armenian? So because it is a native language for children nowadays. It doesn't matter where it is. So can you tell me if it's only in Armenian, so we can answer that one text question?
We have in 3 languages, Armenian, Russian, and English. So people in those 3 languages can use it. But of course, we have plans to create more languages and help more children. The method is the same, the approach is the same. We just need to translate it and take into consideration the cultural differences, and then everyone can use it. Okay. Well, thank you. It's wonderful to know that it is being available in those languages, and hopefully soon in many others. But again, technology, I think any child immediately knows what to do. Yeah. So, Elina, I'm reflecting on your journey. Is it short? Was it fast? It's fresh. I mean, I did not know the name of your company, for example. So I know that now you have one. So you might want to talk about that. Where would you say you are in terms of your footprint, and what's next from where you stand right now?
Yep. So we are pre-launch. Right now we're sort of in the very early stages of the business, but we like the name Cocoon Care because I feel like it really encapsulates what we want, like the mother to feel. We want her to feel protected, surrounded by support, like a ring of support. And then we really wanted to put the care in there, because that's what we feel is missing today in the maternal journey. And then in terms of the footprint, I think in the short term, it's pretty straightforward. We want to have positive impacts on a mother's birth journey. And in the long term, what we're really looking to do is create like a comprehensive maternal care. We want that to be the norm, in the US and Armenia and globally, where that is like, table stakes, is every mother is getting comprehensive care. And, I think even further, it's the ability to influence laws, to be really like a change maker in the field.
I see.
So we have a lot cut out for us.
You sure do. And you are launching this here in the US and then moving it on to other areas.
That's right. Mm-hmm.
Okay. So Mariam, in a Forbes magazine article in which you were featured earlier this year, it stated the app already has over 500 users in Armenia ages 20 to 35 and 7 consultants. Can you give us an update on your users and what is the outcome, the results, since then? Let's put it this way. And where are you stretching out to? Who's using the app?
Well, at the moment, we have 22,000 users on SafeYou, but combined in Armenia and Georgia. Because we're also active in Georgia, and we have like more users there because we had chance to promote, like our partners had chance to promote it in their country, and us because of war. Unfortunately, we didn't have this chance. So our platform serves as a safe space for this 22,000 women. We had more than 5,000 alerts, like people, women that are alerting for help. And we're working now in Armenia. We are working with the Ministry of Justice, Ministry of Labor and Social Affairs, Human Rights Defender Office, police, United Nations agencies such as UNFPA and UNICEF. And through our partnerships with UNFPA, we are also expanding now to Iraq. And we're also recognized as a digital public good, which I will elaborate later on other questions. What does this mean?
When did you, remind me again, when did this start? When did you start SafeYou for the kind of the year?
I started SafeYou last year during lockdown, just before, unfortunately, the war, with my newborn baby. That was the situation in Armenia and the world, and that's when SafeYou was also born.
Well, it's definitely something. All three of these is something that we need. Where it's for the healthcare, maternal healthcare, for all children, from mothers to protect mothers, then to have the children, and then to also raise children who have communication skills problems, and to be able to have basic life skills. Now, just hypothetically, I'm going to ask all three of you, or each of you, what results, let's imagine you are already in the future and you have the result, what results you've got, and then you're looking back to say, I've made a difference. What results when do you foresee, or how would you foresee you've made a difference? Is it when it's spread all over, or if you've helped 20 to 50,000, or what is the ultimate gratifying point that will say I've made a difference? Any one of you, or all of you?
I can go first. I sort of mentioned this earlier, but I mean, I think it's really just making sure that comprehensive maternal care, like postpartum care, is a common and expected part of the journey, that every woman is getting, every new mother is getting that comprehensive care, and they expect it and they deserve it.
Okay. And Elina? Gayane, I'm sorry.
No worries. I would say it's ongoing process, when you're just starting, number of 100 can be satisfying for you, but then you are saying, no, there are like 24 million, 40 million people who need it, then you are just going again, next step, next step, next step. ideally it would be like covering, like globally, helping globally. But of course, everyone realizes it takes time, and it's really hard. So when I'm looking back and I'm seeing that there is a progress from 100 to 500 and 1,000 and so on, yes, it's a progress and it's satisfying. But then you are looking forward. No, I need to go forward. There are like more steps that I need to accomplish.
Yes, and Mariam, I know you're all making a difference right now, but how does it make you all feel that you're doing something that is actually changing the way the world sees and deals with issues that are very important? Please, you know what I'd like to do actually is have you talk about a bit about the way these apps will work. For example, for Noomee, how would it work for the parent, the child, and the therapist? How do they do that? Is it a click of a button? And is it free? Is it how much does it cost? You know, to be part of that.
So people can download it from the Apple Store, Play Store. There are just a couple of questions that, because we're providing individualized program, depends on the child's IQ level and development level. So the parent or the therapist need to answer to a couple of questions. And then we are giving opportunity to the parent or to the therapist. So it's like two platforms, but depends on which one they are choosing. It's we're providing different. So for the user, it's just one. They're seeing one part of it. They are customizing it. They can customize it to each child's needs, and then can use it during the therapy sessions. After it, parent can use it, and it's very easy, intuitive, and we are always going back to our customers because it's still new, to understand their feedback, and based on that feedback we are working on making it more easier, more intuitive. Children understand it better than parents and therapists, as you mentioned. They are native speakers of technology, so even we tested in Luxembourg, the child didn't know Armenian, and he could understand from the pictures what's going on, what they're saying, what to do, and so on. So it's really impressive. It's at this point it is free. We are changing the business model, and depends on the country, the charges will be different. It's monthly subscription from $15 to $40.
I see. Okay. Affordable. Yes.
Yeah.
Totally affordable. Mariam, does SafeYou cost anything, and how does that work? I mean, I've got the app. What is it? How do I make a connection to somebody if I have an emergency? What is the, how does it do?
Well, SafeYou is free for end users. And all the functions of SafeYou are free. Even sending SMS doesn't require to have any money on your phone, because everything is facilitated through our system. So when you're in danger, you can, you choose emergency contacts, up to 3 contacts from your contact list. These are your friends and family. Up to 3 contacts from different NGOs, initiatives, organizations like Human Rights Defender Office, for example, also is there in Armenian case, or any other governmental entities that are, for example, crisis centers, shelters, etc. And this, the last one is the police. So when you are in danger, you press one button, and all these 7 directions are getting free SMS with your geolocation and with a short emergency message, and also with the map, like with the link that goes to the map with your pinned location, because sometimes just the address is not enough to understand where the person is. And this is just one function. The second function is network, where we consolidate all available resources. For example, how to get to shelters, to all or what are the hotlines, what are different organizations or individuals that are working in the field. And the third and the most engaging one is forum section, where women engage in topical chat rooms that are created by different, again, organizations and professionals. And that's where they anonymously talk about the issues, and they're having consultants to talk to them and provide consultations. Like there are psychologists, doctors, social workers, lawyers, like working with us and within our system. And this is how it works for end users and for shareholders with whom we're working, like governmental entities or civil society organizations, international organizations. They're provided by different, let's say, dashboards with different tools for different types of statistics, analysis, mapping of cases, and also they maximize connectivity between this shareholder, like stakeholders, sorry, and users. That's how it works.
It's a lot of connecting, a lot of consultants that you must have, and a lot of counselors and therapists, and it's definitely an app worth having anywhere and everywhere, not just for domestic violence, but probably walking some of the streets in the worst parts of the United States as well, or anywhere in the world. So again, it's I appreciate the work that goes into it. Now, you know, I heard how Cocoon Care, the name came out, and I understand SafeYou, but I'm going to come back to for a moment to Gayane, because what does the name Noomee? I mean, when I heard Noomee first time, I thought it was like N-E-W-M-E, you know, like the new person. Noomee. So can you tell me what that means? So that, and then please.
Yes. You are right. It's new me, but in a childish way.
Okay.
Like,
all right. Okay.
We're learning, helping children to develop skills that they have. They just don't know how to use it. So it's like new me in a childish way.
So I guess I was on the right track there, right?
Yes,
as an adult. Yes. Elina, on how your app works, is there any way you can kind of give it? I mean, I know you have throughout today's session, but how is it going to be made available, and how will people be able to benefit from it that way?
Mm-hmm. Sure. So the solution that we're going to go to market with is a digital tool, so an app, as well as an in-person care facility. And then with our digital tool, a customer will be able to discover content. There'll be like digestible, high quality content from, you know, breastfeeding to postpartum recovery to postpartum depression, different little snippets of video that you can access 24/7. We're also going to have live streaming classes as well within the app. So what to expect, you know, in childbirth and all the other things that new mother wants to know. And then also the ability to schedule telehealth appointments with your providers, from your OB to midwife to a lactation specialist, all the provider teams that you need to have. So that's the digital tool. And then for the in-person facility, we're really excited about this. This would be an actual, I don't want to call it a clinic, but it's more of a medical resort or a spa, you know. So there's going to be mothers can come there after having the child, and that's when they have their ring of support, when they have like actually hands-on care in the in-person facility. So we feel that with this type of healing that is needed, it would be marrying sort of the digital and then the in-person facility. And there would be kind of like an overnight stay, like hoteling. So kind of marrying the two.
where was this app when I was having mine? And needed all the assistance, and you had to drive away, or you had to call a physician and get the exchange service. Oh, anyway, I am so glad that we are now moving towards this. You know, people say technology can complicate our lives. Well, it definitely does, because if you're not understanding it, but it also actually is making our lives so much more easier and more functioning, more less time consuming. There's a question here from Lotta Hairapetian. It says, what are your growth plans for the next 2 to 3 years? I mean, this is in general for everyone. And how can Aiwa and Aiwa UN teams help you now with that growth? So maybe that's something that you would like to let us know and see if we can work on it for you. What is it that one can help here? I mean, we're introducing you to this. You're working with BHA and others. You're partnering with great associates. What would the role be for Aiwa and the UN? You're approaching all of these.
Yeah, I can go.
Mm-hmm.
I think for all of us, as we mentioned, it is important network and communication. So Aiwa, UN, who can connect with the right network, stakeholders for each of us, that would be a great impact on us and on the community, on the society.
Okay. So I think our audience heard that, and we can address that in a bit. I want to ask you if you have anything that you would like to say about your app at this point, because then I want to ask you about your immediate families and your families, and you know how difficult it is to work and do come up with these creative, these innovative apps that help others at the same time you're working with family members, whether it's parents or sisters or your own immediate children. How do you put all of this together? The family time, the time in business, the travel.
Sorry, first of all, we have to, we will need to answer the questions from Laura, right? Or it's not? Okay, I would really like to also answer her first and third question on what are our plans for growth. Because she asked, what are your growth plans for the next 2 to 3 years, and how global you would like to be? So and also we'll try to somehow approach the second question, because it's really important. As I said, SafeYou is the first Armenian software solution that is recognized as a digital public good, and this recognition comes from UN Secretary General, and I'm happy that we're having this conversation through UN Aiwa partnership. And well, this recognition already itself accelerates our global growth, because we are welcomed in the countries that are signed under the UN Sustainable Development Goals, because being recognized as a digital public good means officially contribute to the attainment of Sustainable Development Goals, and the goal that we are contributing is gender equality, number 5. And I'm sure that there is a lot of perspectives for collaboration between Aiwa, UN, and our organization. And for the next 2-3 years, we're planning to enter US market. That's in our plans. We also have a lot of plans for fundraising to improve and advance the technology. We're already starting to work on some AI integration for data analysis system that we're building right now. So, and for our global growth, by 2030, we're planning to be in at least 60 countries and impact the lives of 100 million women. That's our I know that's very ambitious goal, but we can do that, and we have to do that because even from the perspective of the economic cost on our economy, global economy, because of violence against women, annually we're losing $1.5 trillion, which is big portion from the global GDP. So we want to be, we really want to help to transform the culture of violence against women and shape policies that can be on the prevention side. So preventing violence against women is our ultimate goal.
Well, thank you for bringing that up that way. Now, let me. Are you speaking for everyone there then? So anyone, Elina, do you have anything to add to that?
Yeah, I'll say kind of similar to Mariam. It's, you know, making connections with people through Aiwa UN, facilitate conversations with people who can influence laws and policy. I know the issue of maternal care is really a global, you know, a global issue. A lot of governments are looking at that. And then I think, you know, given that we're at the early stage and we're pre-product, any access to grant funding or things that may be upcoming would be something great to know about.
Okay, very good. And from here, let's see how global you want to be. I'm looking at, I keep getting texts and also information coming in. So I'm trying to keep up with those. Unfortunately, we could not go live on Facebook. It did not seem to work when we clicked the button 3 times, 4 times, but we have recorded. But I do want to mention, since Mariam mentioned about the gender equality issue and the UN, at the beginning, when the recording didn't come on fast, I did mention and reiterate for those who weren't here, gender equality is the key component of the 2030 Agenda for Sustainable Development established by the United Nations in 2015. So the goal is to reach as many people and to improve the lives of millions of people by 2030. Now, gender equality is also one of the 17 UN development goals, and it is the abiding focus of the Commission on the Status for Women, the CSW, which is the largest UN gathering on gender issues. And of course, as always, Aiwa's aim is to bring Armenian women's voices to the UN, represent Armenian women's interests, and celebrate Armenian women's brilliant work throughout the globe. I'm trying to see if we do have any other questions or issues. And now I want to come back to the family then, very quickly. We do have a few minutes. I'd like to know your families, a bit about your, instead of the business side, the family side. Mariam, you mentioned you had your one child, and that's when they said, dommage or shame, that it'll be a boy next time, never mind. So where are you now on that, for that 80-year-old woman?
Well, I'm really privileged to have a very supportive husband who is very, he's even very helpful with the startup, having a financial background and business background. He really helps me with business model, with a lot of like financial projections that we are doing and analyzing. Of course, it's very difficult to build a company when you are a mom, when especially during lockdown. You know, it's a very interesting moment to start a company. Of course, it's difficult, but the best thing here is that it's doable, and you can really motivate people to support you, even if they don't understand why you are doing this. Still, for all mission-driven companies like Noomee or Cocoon Care, it's really very easy for us to convince people that what we are doing and our families, that what we are doing is important for our family, for our children, for the society, and then people and your family starts to support you. It's a very beautiful moment when you convince them, then you convince the world. You know.
Yes. Yes. The family support is, I believe, one of the most important in whatever we do in our lives. I know that Elina mentioned that her husband was also one of the co-sponsors and stands beside her as well. And can you tell us about your family just very briefly?
Sure. I mean, I think when you set out to start a business, it just zaps all the resources you have. So everyone needs to get on board. So it's a full, it's a family affair. So yeah, I have an almost 2-year-old son. So there's a lot of, juggling of work and startup and family life. And I think because I'm doing this with my husband, it's conversations are always about the startup and how do we make things better for other people so that they have a better experience than we did. So it's all sort of a dance. I think there's ebbs and flows where there's some weeks where you're doing a little bit more on the startup, other weeks your child needs your attention and he's going through a milestone. So I think that's a really interesting thing as women can really do it all, and it's difficult, of course, but we somehow manage to do it. And so I'm really excited to be in the company of these other women who are starting their own companies and changing the way things have been.
Yeah, you're in good company, all of you, all three of you. And Gayane, any family news?
Yeah, mine is a bit different. Mine was, I was struggling. I was single, and like my parents, like, you are a building company. It's a hard, think about Armenia, so like think about family and so on. But when there was a time I wanted to just stop, they said no. They were just pushing me and asking me to go forward. But with the help of Noomee, I also found my love, my boyfriend. So we met, we both together working at Noomee. So it's with the help of them, their motivation, they inspire. I'm doing what I can and helping to grow as a person and as a CEO, as a leader. Just go forward.
Well, all three of you are on the road to changing the world. So the issues these apps address have no geographic borders and or boundaries. They exist and they are growing in all neighborhoods and among most cultures. So Elina, Mariam, Gayane, your innovative minds, the courage, the tenacity, your passion, your energy toward your self-assigned tasks, they provide a more secure and swift path to the well-being of women and children in Armenia, in the diaspora, and across the globe with one click of a button on these apps. And for that, we thank you. And thank you for sharing your journey and your challenges, your experiences, your partnerships. And you know, partnerships actually help build a culture of support and allow us to grow exponentially. And to our listeners, we appreciate that you devote part of your weekend to Aiwa and to our programs. Your presence inspires us to learn more, to do more, to become more, and to lead more. Now, please look out for future Aiwa events We have another event coming up Tuesday, November the 16th at 4 p.m. Pacific, 7 p.m. Eastern, when we will be hosting Her Excellency Lilit Makuntz, Ambassador of the Republic of Armenia to the United States, and Dr. Ana Hovnannisyan will be moderating that 1 hour. Meanwhile, I'd like you to follow us on Facebook and Instagram. Now, if you want to help Aiwa and the UN build a culture of support for our programs and to encourage programs such as these, and to encourage young female entrepreneurs, such as the 3 you've had today, we encourage you to go to our website, aiwainternational.org, and donate with one click of a button. So, and if you're not a member of Aiwa, then maybe it'll take a few clicks of some buttons, but you will join and become part of the global network of Armenian women who share our guiding values. Our guiding values are always integrity, respect, inclusivity, service, and relevance. I want to thank you all again, the 3 guests, and to our attendees for being here, giving part of your Saturday to spend with us. Truly appreciated, and always remember that there are these young entrepreneurs all need support. So please go ahead and encourage them through your donations to Aiwa and or to their organizations. And you will receive a thank you for all the attendees. And if you could, and our attendees will actually, our guests will actually give us their website address, and we'll put that in there so people can actually go directly to you as well if they don't come through Aiwa. Thank you once again, and be safe, stay well, stay relevant, and we'll see you all next time. And good luck to all of you.